I want to thank Chair Grawl, Chair Masulo for the great work they did, Representative Andrade and Zika. As you all know, we're concluding, I think, the House's business today on the special session, which included 4 bills, the largest of which is a bill designed to protect Floridians, to give sanity and guidance to businesses and employees throughout the state in the wake of sweeping government mandates from the Biden administration. I think the members did an excellent job debating it in short order. I think it was a smooth special session. I couldn't be more happy with the relationship between the House and the Senate, that we're able to bring this together and work on a product. We're going to be watching the Senate's today, but I'm sure they're going to bring it in for a smooth landing. With that, I'll take your questions.
Mr. Speaker, you were off the dais for 3.5 hours, and all of a sudden there were about 9 or 10 extra votes on the final public records bill. What was going on behind the scenes?
Well, we're doing work, as you know. Yesterday I was up there for 5 hours straight. So today we had some work we had to get done, and members did a great job debating things, and all those votes, came in, and all those bills landed.
But I asked someone what that cost, and they just laughed because...
No cost unless cost is good policy. The bill at the end you're talking about, the public records bill, without that bill, there would have been people's private, religious, medical information that would be posted on Facebook potentially if there was a public records request. The idea with that, and I think that Chair Burton and Chair Masulo hit it, right? There was some misinformation that was out there, I think, among some of the members. I think it was an often phrase that I kind of heard throughout the course of the week. Well, HIPAA will take care of their medical information. As you all know, who report in healthcare, HIPAA applies to hospitals, to medical facilities. It doesn't apply to state agencies. So we needed that protection to make sure they protected Floridians, and I think we got that in a bipartisan way.
It seems like one of the central debates today was whether anything was actually accomplished with the special session. Democrats saying it was more of a political show. Your Republican colleagues arguing that it offers protections to Floridians. But with so many of these issues yet to be settled by the courts, do you feel that ultimately the impact of the laws that were passed today will be settled outside the legislative arena and in the courts?
Yeah, well, let's be clear about what the law of the land will be if Governor DeSantis gets the opportunity to sign this bill this week. The OSHA, which I think is probably the largest, as far as being applicable to businesses in the state of Florida, is not in effect right now because it's been held up by a federal court. So if Governor DeSantis gets the opportunity to sign the bill that we've sent him this week, it will be the law in Florida for all businesses. We will continue to have to litigate OSHA to its entirety. I believe, as I've said to you before, that we're going to be successful. It's a sweeping, unprecedented use of OSHA. I believe it is totally unconstitutional. I think the court has temporarily agreed with us. Hopefully that will continue, but I think it will. And there's other issues that we're going to have to litigate along the way. But we plan this week will be the law of the land here in the state.
But what do you do? What do you do if the law, the OSHA law, does take effect? The federal law takes effect, and now businesses are put in a rock and a hard place where they have to comply with either the state or they have to comply with the federal government.
I don't think we're going to get there. Look, I feel very confident on the OSHA litigation that we're going to win. I'll be honest, and I think I may have said this the other day. I don't even think the Biden administration truly believes that they're going to win the OSHA litigation. I think most businesses in the state who are very familiar with OSHA don't believe that this very small provision that the last time it was used was on a very small issue dealing with asbestos being applied in mass to vaccinations and forced vaccinations in the United States is something that's going to stand scrutiny.
What do you say to critics who think that Florida has been sort of sliding towards anti-vaccination policies as the pandemic has worn off?
I think that's ridiculous. I don't think we've done that. Governor DeSantis has traveled the state, setting up vaccination locations for people. We've been very, very active making sure people have the ability to get the vaccination. I think that we're getting to this place where, nuance is lost on everyone. You can be for a vaccine or for the opportunity for people to get a vaccine and still not support a massive government forced vaccination. This isn't hard, and it's not even really that nuanced. I support people's ability to get the vaccine. I think it's right for a lot of people to go and get the vaccine, and they should avail themselves of that opportunity if they think it's right for them in conversation with their doctor and their family. But there are people who don't feel that way. And they don't feel that way for a variety of different reasons, whether it's because they're pregnant, or they have a religious objection, they have a rare medical condition that we don't have. Whatever that issue is, the bill that we passed today will help them have the opportunity to say, this isn't right for me, my doctor doesn't think we should get it, I shouldn't be forced to do it by government.
Speaker, there is a lot of talk about the effect this has on businesses, but there are hundreds of businesses that have already put these vaccine mandates in place, and this bill is not retroactive. It will have no effect on those. So, and at the same time, we've got, as everyone has talked about, COVID cases in Florida are dropping. So in some ways, what is the practical effect going forward besides sending a message to the federal government?
I'm going to flip that a little bit, Mary Ellen.
Yeah.
What is the practical effect of the Biden administration when we are now the lowest in the country, towards the bottom end in the country of COVID vaccinations, of dictating to Florida businesses how they need to handle their vaccine, even though they realize that they're going to lose a lot of them are going to lose a significant number of their workforce, which is going to strain all kinds of issues for us here in the state of Florida. People are going to lose their jobs as a result of that when, to your point, vaccinations are very low. The answer to that is it is a political decision. It isn't a decision based on science. It isn't a decision based on good governance, which is why we were here this week, which is why we passed the bills we passed.
Speaker, how does all this affect healthcare industry and healthcare workers specifically? Because you talk about the lawsuits and stuff like that over the OSHA rule, but the CMS has its own rule. Are you as confident that that rule will be drawn down, and how will the soon-to-be laws passed today affect workers where you already have healthcare facilities and industries saying they're going to have to go with the federal law because that's their Medicare and Medicaid?
Yeah, I'm less familiar with the cases around CMS as I am with the OSHA litigation, which I think is just ridiculous on its face. We're obviously going to have to litigate CMS as well as OSHA, as well as government contractor, right? These are three buckets of litigation that we absolutely have to pursue as a state, which is why we provided the money for the Attorney General to make sure that we could do that effectively and adequately. We included, which is why we've said this is one of the most aggressive in the nation when it comes to protecting employees from this sort of forced vaccination from Washington, D.C., because we included healthcare in that. We think that that's the right decision. And I think it's not just us saying that. Look around and look at the healthcare providers. Look at the hospital CEOs. I mentioned Alan Levine the other day because he's a former OSHA secretary who testified in the United States Congress about this issue and says that it was punitive on healthcare employees who have been on the front line of the pandemic, caring for patients throughout the course of this, that they're now going to lose their jobs. He also said that he was going to lose a significant portion of his workforce, which was going to hurt his ability to make sure he was providing adequate and effective health care in his community. Now imagine that. Here we are, to Mary Ellen's point and question, here we are, we have one of the lowest infection rates in the country on COVID, and as a result of a federal government policy, we could be in a situation where our healthcare providers become strained, not from COVID cases, but because of a decision made through rule by the Department of Labor through OSHA. That is wrong. It is absolutely wrong, which is why we decided to include healthcare
Under
workers.
HC1, what do you expect to happen if a school board does pass a mask mandate if there's like another surge in COVID cases? Do you think that they're going to get a barrage of lawsuits or things like that?
Well, look, we put a process in there that says that there's no mask mandate. The school districts can't do that. The parents have the ability to decide whether or not they send their children to school with a mask. It should be the parents' choice. All of the reasons we talked about on the floor this week. So we basically allow them to file a suit against the district if they violate our law, recoup their attorney's fees, because they shouldn't have to go to court to get the government to follow the law. And by the way, I want to say this. I don't think the districts are going to break this law. Right? We put this in as a safeguard because there's been some confusion during the executive order where some districts have said they're not going to do it. It is my hope that the districts are going to follow this law and that provision will never need to be used. But in the event that somebody decides to flaunt the rule of law, then there should be an opportunity to correct that.
On that issue of this not being retroactive, what's your interpretation of what does this do for local governments that have a vaccine mandate in place now, and employees may have been punished? And likewise with businesses, are those cases still going forward?
Well, look, we've had a lot of people, government included, right? I think we had several firefighters and people throughout government who were given a deadline. Hey, get your vaccine by this date or lose your job. They're not losing their job under this bill. That's not happening because we specifically said, as it relates to government, they are not allowed to be terminated for the vaccine. We didn't go into the exceptions because those are political subdivisions of the state, whether those are cities or counties, they're government employees. We made the decision to say this is not in no way going to affect their employment.
But the people that have already happened, or it's already happened, you can't do anything about that.
I don't believe that there are many people who that has happened to yet. I think most people have been given the deadlines. And let's be honest, I think a lot of these businesses are responding to the deadlines that were set by the federal government. So when OSHA came out the other day and said, we're going to move this back a little bit, which of course they did because they didn't want the bad politics of people losing their job right before Christmas. That's the reason, right? They didn't want people being upset because their toys weren't being delivered to the store. That's why they did, not because they cared that people were actually going to lose their jobs. So what we've said is, those deadlines are in place, they have been set by their employer, and that doesn't matter. When this law applies to them, they are not going to be able to fire that employee regardless of whether they had the policy beforehand.
On the legal
Last
challenges,
question.
Governor Ron DeSantis has said that if the state were to remove the legal challenges and the federal rule stands, he would direct businesses to not comply and direct the legislature to use stimulus money to pay off those fines. Is that something the legislature could seriously consider?
Look, I think I want to go back to what I said before. I think we're going to win the litigation. I really do. And I think that where we're in a situation now is we have multiple active cases going on. We need to pursue all of them. We need to pursue CMS. We need to pursue OSHA, which we are, and we need to pursue government contractor. I do think we're at this inflection point now where, the federal government is now saying that they will use any power at their disposal because they believe the ends justify the means. And I think that's a real problem. It's a real problem for us as Floridians to think that regardless of what agency it is, there's no active Congress, there's no people's representatives, that the executive branch bureaucrats are going to make law and they're going to try to apply it en masse. That's why we're here. We're going to fight them in court. We fight them this week. I'm sure because of the great work of President Simpson in the Senate, we're going to get that bill to the governor tomorrow, and I'm looking forward to be there at the signing. Thank you all. Appreciate it.